This is Captain Hamilton, part of UAMTF 332-1 out of Newark, New Jersey.
Lieutenant Michael Dolan, coming to you from Newark, New Jersey. Here with the 332nd Urban Augmentation Medical Task Force supporting University Hospital.
My name is First Lieutenant James Ennis. I am a family nurse practitioner deployed to Elmhurst Hospital in Queens. Some have called this the epicenter of the epicenter, and that was very true when we first got here.
And this is a day in the life of a Nurse Corps officer fighting COVID-19. So we were activated back in March. Then we found out that we were going to be coming to New Jersey to work at a federal medical station, very similar to the Javits Center. We helped get it set up, and we were working night shift.
This is the exact reason why I joined in the first place. It's the ability to do the job that I love as a nurse and a nurse practitioner in places where the most need is present.
So these patients were all COVID positive, and they were fairly stable, but they did need some sort of oxygen supplementation. So we were kind of the transition between the hospital, like the acute care setting, and we did that for about 48 hours, and I think it became very apparent that the civilian hospitals needed a lot of help. This was back when the numbers were still very high and a lot of people were still coming to the ER, and the hospitals were still being pretty overrun. We integrated into University Hospital, which is a state hospital here in New Jersey. It's about 510 beds, I believe. I was placed on the critical care float pool. So it's currently about 6 o'clock. The shuttle does its first run from the hotel to the hospital around 6:15. I think we're ready to go. I feel like a lot of things have kind of become our new normal since we've been here. I think a lot of healthcare providers across the nation probably feel the same way.
Never forget my first day at the hospital. When you hear about what's going on here in the New York metropolitan area with the breakout of COVID-19, I mean, you really don't know how bad it is here until you see it firsthand. Seeing that hospital for the first time just completely overwhelmed with patients. I mean, there were patients on stretchers in the hallway, basically.
We often take for granted the human connection that's present in medicine.
All of us here at UAMTF 332-1 feel really honored to have been able to come in to help this hospital in their time of need, not only as medics and providers and nurses, but as soldiers as well. First thing we always do when we get to the hospital is we get our temperature checked. Make sure that we're not running a fever. And then we get one of those stickers to give us the all clear to come in. So first thing is, I've got to return my old scrubs first. I can head downstairs, get my assignment, and get my mask for the shift.
I was at the hospital for about 14 hours today, working a shift. Today I had 2 patients with COVID-19. Essentially, we've pretty much only been taking COVID-19 patients. I think pretty much every ICU patient at the hospital is there for the virus at this point.
I just got back from the hospital. As you can see, my face is a little bit red from the N95 mask still.
And then on top of your N95, you usually put a surgical mask too, just to keep things from getting on the N95. And then of course you got your splatter shield face mask that you put on too to prevent stuff from getting directly on you.
It was a good night. Patients did well. We're kind of coming to the end of our stay here. I will say that, things have gotten better since we've been here. I am so glad that we came because the hospital definitely needed our help.
When we showed up, they were like in tears because, there are 85 soldiers there to come and help.
And I am honored to have been able to come here as a nurse, to come here as a soldier, and be able to help the community in their time of need during the COVID-19 pandemic. And I have just been exceptionally honored to be able to provide care to these patients over the last several weeks.
Over the course of the last several weeks, we've transitioned to a floor on the hospital, and we are mostly taking care of COVID medical patients. It's been difficult to try to manage this novel disease, but I think as a team, including myself, several other advanced practice providers, some physicians, our nursing staff, our medics, and the rest of our multidisciplinary team we've been able to make a significant impact here at Elmhurst Hospital. I look forward to continuing our work here and hope to be home soon.
So that's just kind of a day in the life of a Army Nurse Corps officer fighting COVID-19. Hope you guys stay healthy and
take care. Wish us safe travels as we head home tomorrow.
We will see you later. Bye.
Go Army. Hooah.